So as Yanina and Yeji are going to go through with you, it really took more than a century to build our public hospital system and our public healthcare system. And they sort of grew up together. And I'm going to skip over this part because they're going to cover it with you. But um, the main thing that you need to know is that the idea was, unlike the United States, Canada decided that as a society, we were going to pool our money through our taxes and we would provide public health care for everyone based on need. That's what public Medicare is. And so this is a picture of Justice Emmett Hall, who was the chair of the National Commission on Public Health Care, and recommended a single tier, as we call it, single tier public health care system. And this is what he said. He said, as a society, we are aware that the trauma of illness, the pain of surgery, the slow decline to death are burdens enough for the human being to bear without the added burden of medical or hospital bills penalizing the patient at the moment of vulnerability. The Canadian people determined that they should band together to pay medical bills and hospital bills when they were well and income earning. Health services are a fundamental need, like education, which Canadians could meet collectively and pay for through our taxes. And so that is the fundamental principle of public Medicare. And when we get to Yeji and Yanina's presentation, which I think I'm going to do now at the end of mine, before the Q&A, you'll hear one of the stories of life before Medicare, which some of you may remember, and what it was like for people before we had public health care. So the fundamental principles of public Medicare are compassion and equity, right? That we take care of each other, that we care about each other's suffering, that we're not an individualistic society that says sort of sink or swim on your own, and that people are supported in their ability to live to their human potential, that we have an equal ability to prosper if we're able to. Under the Canada Health Act, all medically needed hospital care, and that includes surgeries, lab tests, diagnostic tests, and all the staff and equipment associated with them, are covered. I'm going slowly so Shulin can translate, but I'm also going slowly because I want to be super clear. Everything needed for your hospital care, medically needed, is covered. Every Canadian has the right to these on equal terms and conditions without user fees or extra billing. All medically needed services are to be covered. Okay, that's under the Canada Health Act. Ontario has its own legislation that sort of sits under the Canada Health Act. And also it was brought into to strengthen the patient protections against user fees and extra billing. And it's called the Commitment to the Future of Medicare Act. And it was brought in by the Liberal government in 2004 in Ontario. And it says that it again reiterates, like the Canada Health Act, that user fees and extra billing are banned. You cannot pay your way to the front of the line. Your access to medical care is based on your medical need, and extra billing, that is billing OHIP and billing the patient on top, or charging user fees for needed health care, are banned. And under the Commitment to the Future of Medicare Act, no person or entity, so like no private clinic, no person, can charge a patient for access to an OHIP covered service. And if they take payment for a covered service, they can face fines at this point of up to $200,000 and ultimately jail time. At the moment, the maximum is a year in jail. So what is OHIP and what does it cover? And I'm just going to stop and check in. Are we doing okay there, Shulin? Slow down? Okay. Thank you. I'm gonna share my screen again. Okay, so back to, and how are we doing for the students? Are we okay? You're getting there for your presentation? You'll
Yep,
let
I
me
have
know.
the video and I'll screen share it at the end.
Okay, perfect. Okay, so what is OHIP and what does it cover? Shoot, my screen is doing a weird thing. Can everyone see my screen now? Is it on the right screen? Okay, good. You'll let me know, right? If it isn't, it's frozen now. Sorry, when you go in and out, you have to start again. I'm gonna just try again. Sorry, from the current slide. Okay, go ahead. There we are. So OHIP covers doctors or their equivalent. That is your family health team, nurse practitioner-led clinics. I'm saying this on purpose because we are seeing nurse practitioner-led clinics where they're charging patients. That is not allowed under the Canada Health Act, and the government of Ontario should not be allowing it to happen. Community health centers. So they are covered. Hospitals, including all medically necessary surgeries and diagnostic tests in and out of hospital. That's lab tests, MRI tests, CTs, colonoscopies, endoscopies, etc. Medications in hospital and all care necessary for your hospital stay, diagnostic test, or surgery, including the nurse, taking of patient records, creams, or medicines, okay, that are required for the surgery. Okay, so what's covered under OHIP? So doctors are covered, needed hospital care is covered, diagnostic tests, some physiotherapy in OHIP clinics only, and there's too few of them and long waits, and so only a bit of physiotherapy. It should be covered. Also covered, not necessarily under OHIP, drugs for seniors. Long-term care homes are subsidized, and I just put the maximum fees there. And if you're on a pension, they give you a comfort allowance of, I forgot what it is, 200 and something a month, and they take the rest of the pension. Some home care is covered, but it's rationed. Speech language pathology for children, annual eye exams for children and seniors. So what isn't covered? Well, if you want a private room in a hospital, you have to pay for that. You have to pay extra for that. However, if there are no basic rooms available and the only room available is a semi-private or private room, they can't charge you for that, even though sometimes they try. Room and board for a chronic care hospital stay. So if you are a patient who requires chronic care, that's long-term care in the hospital, basically you're living in the hospital, they can't charge you for the medical care, that is the doctors and the nurses, but they can charge you for your room and board. And they charge at the same rate that they charge in a long-term care home. So that's called a copayment. So for your chronic care hospital stay, they can charge for your room and board. That is allowed. Physiotherapy in private clinics, medications outside of hospitals, medically unnecessary tests and procedures. So an example would be cosmetic surgery. And then some things that have been delisted, like audiology, chiropody, they used to be covered, they're not anymore. Speech language pathology for everyone except for children, eyeglasses and exams for adults. Okay, I hope this is clear. So what is not allowed? So they're not allowed to extra bill you. That means they can't charge OHIP and then charge the patient an additional fee on top. That's not allowed. That is both unlawful under the Canada Health Act, so the province is not supposed to allow that to happen. And if they do, the federal government claws back money from the province as a kind of penalty to uphold the Canada Health Act, and provincially, under the Commitment to the Future of Medicare Act, it's illegal. It's illegal, and the doctor or the clinic, anyone who's taking that payment, is supposed to get a fine. And ultimately, if they keep doing it, the fines go up, and there's jail time. Similarly, user fees. You cannot charge a user fee for a medically needed service. So that's just clear, I think, what a user fee is. Upselling. So this is when they convince a patient to buy medically unnecessary tests or procedures or medical equipment and supplies, like attached to a medically needed service. An example would be you go for a colonoscopy and they say that, oh, well, actually, it's better for the cataract surgery. A good example would be that they tell you that there's an eye measurement test, and they persuade a patient to buy the eye measurement test that is not covered by OHIP. Or they sell you specialty lenses attached to your cataract surgery. So you go in for cataract surgery, but they upsell the patient special lenses. Now, ethically, doctors are required to give you, patients have a fundamental right and to informed consent. So they're required to give you full information about your patient choices and the outcomes associated with those. And they're not allowed to just try and manipulate you into buying extra add-ons that don't actually do anything or that might be risky. So manipulative upselling is when they try to sell these extra things and um they pretend that they're better than they are, or that they have better outcomes when the outcomes are the same, or those sorts of things. Or they pretend that they're good and not risky when they are in fact risky. And queue jumping is when they sell patients faster, what they say is faster healthcare if they pay out of pocket for it. Okay, so all of those things are not allowed. So I'm just going to run through some patient examples. Actually, before I do that, I just want to talk with you about cataract surgery a bit, because in Ontario, the most common private clinics are cataract surgery clinics. And this is where we see the most common violations of the law. And so the government of Ontario, under the previous government, the Liberal government, provided two very good kind of documents that help sort of go through the key information. I'm just going to share my screen and show them to you. These will be on our website tomorrow, along with a fact sheet about cataract surgery. But this is an info bulletin from the Ministry of Health. And it gives kind of in-depth information about cataract and lens insertion surgery. And it's very clear that cataract surgery is covered when it's provided by any method. So they'll often say in the private clinics that, we do laser surgery or some kind of special laser surgery for cataract surgery. And so we're charging for that. Or that OHIP doesn't cover that, and you have to pay extra for that. All of any type of cataract surgery is covered. There is no basic lens. Cataract surgery is individualized, and they have to assess your eye and tell what kind of lens you need. They can't charge you for a lens that is needed for cataract surgery. So this info sheet kind of gives all the information that you need, but very commonly what we hear is patients being told that this particular type of cataract surgery is not covered. Laser cataract surgery is not covered. This particular type of lens is not covered. All of that is not true. So this is from the ministry itself. Cataract and IOL insertion surgery is covered when provided by any method, including laser surgery. Okay, and I'll tell you, under the Ford government, they've taken this down off the website. Like you can't find these, but these are the facts. Okay, there is no standard lens. The medically necessary lens is determined for each patient based on individual patient assessment. Okay, this is whether the service is provided in a hospital or in a private clinic. And then you can buy, if you want, a lens to correct astigmatism or something like that. And you can even attach that like to your cataract surgery, but you do not have to do that. And yes, you can pay for like vision correction at the same time. And those are medically unnecessary things that you would pay for. Okay, I'm hoping that's clear. But so there's a lot of manipulation that's going on about this. And so we've created this fact sheet. I'm just going to show it to you for 1 second. That kind of goes through all of this information in very plain language. And so, OHIP covers all medically necessary surgery and diagnostics. Q jumping is prohibited. Laser cataract surgery is covered. You can't be required to purchase a medically unnecessary thing to get a medically necessary thing. So when you go in for a colonoscopy, they can't say you have to pay for a dietitian or a consult for a dietitian in order to get the colonoscopy. When you go in for hernia surgery, they can't say you have to pay for a dietary consult or for physio or something in order to get the hernia surgery, for example. Physicians and clinics have to provide patients with proper information to make an informed decision. Probably going too fast for Shulin. As I said, there is no standard lens. They cannot charge you for the medically needed service, even if you opt to pay for some kind of extra that is medically unneeded. Okay, and everything associated with the surgery that you need. So you need eye drops, it's covered. Okay. So I'm just going to go through the very last part of my presentation and then over to the students for just a few minutes, and then we'll open it up for questions and answers. Are you okay there, Shulin? Okay. Thank you. Okay, so this is the last part. I want to run through some patient examples with you, okay? So you get the sense of what's happening. I'm just going to share my screen again. Sorry, each time I have to go out or it will freeze. So just 1 second, there we go. And so patient one, hang on, I just have to move these windows around so I can start from the current slide. There we go. Okay, there we go. So this patient needed an MRI for her open heart surgery. She found a private clinic where she could get the MRI. They told her she had to pay $2,000 for the MRI. When she got her bill, they said she was charged for contrast, not the MRI, but that's not what they told her. So let me ask you, you can just put your thumbs up or thumbs down. Is that legal or illegal? Are they allowed to charge her? No, that's right. They are not allowed to charge her because it's a medically needed MRI. She needed an MRI. It was ordered by her doctor for her open heart surgery. If she needed contrast in that MRI, then it's covered. If she didn't need contrast, it wouldn't be covered, but if she needed contrast, it's covered. They're not allowed to charge her for the MRI or the contrast, and they're not allowed to tell her she has to pay $2,000 for the MRI and then on the bill put that she paid for contrast to try and skirt around charging her for the MRI, if you get what I'm saying, right? Okay, next one. Okay, patient called Herzig, this was me, so I'm naming the clinic, to schedule a cataract surgery. I asked how much it would cost. They told me that they are not covered by OHIP, and the price would be $3,400 plus. So legal or illegal? Legal or illegal? Completely illegal, not allowed, not allowed at all. They are covered. OHIP is the law of the province. I don't know what they're even talking about. I don't know how they got their person to, trained to say that, but not allowed, right? Cannot do that. Cataract surgery is covered. It's a medically needed surgery. Okay, patient 3. He made an appointment for cataract surgery at a private clinic, and he was told he'd have to pay $1,200 per eye for a total of $2,400. He was told that the clinic only did special lenses, and if he wanted the surgery without them, he'd have to wait a year to go for surgery somewhere else. Legal or not legal? Legal, not legal? Right, you're not allowed to attach buying a medically unnecessary thing to charge someone for a medically necessary thing. You're not allowed to do that, right? But the clinics do it. Okay, so you're getting this, right? On to the next one. Okay, so this is a patient. Oh, what number am I at? Sorry, I've got windows over windows here. I'm at patient 4. So she needed cataract surgery and was referred to a private clinic where she met briefly with the surgeon who gave her the information about the surgery. She was given a 15-page booklet of options and she was charged $600 for that appointment. Legal, not legal? Not legal. A physician consult is covered, whether it's the surgery or not. You have to have an appointment with the surgeon to talk about the surgery. It's a covered service, right? Everyone's clear? Okay, on to the next one. These are real life examples, by the way, from the last couple of years. This patient needed cataract surgery. He contacted the doctor at a private clinic and was told to come in for an eye measurement exam. He was told that paying for the upgraded exam would yield better results. He paid $250 for the upgraded exam. Legal, not legal? Legal, not legal? So he was lied to. The eye measurement tests covered by OHIP are interchangeable in terms of outcomes with the eye measurement test that they're charging patients $250 for. The OHIP covered eye measurement exam is absolutely good and sufficient and everything you need. They can't sort of lie to and manipulate you into paying for things by pretending that there's better outcomes than the evidence supports in order for you to get that, right? It's a manipulation, not allowed. Okay. Okay. Patient 6. This man needed cataract surgery. He opted to go to an eye clinic in Toronto. He was told that the surgery would cost $2,440 for laser surgery or $2,190 for keratome surgery, plus a COVID-19 charge of $10. The clinic later tried to persuade him to buy eye drops to use after the surgery for $50. Then they told him that the first checkup was free, but any following checkups would cost $75 per visit. Lawful or illegal? Lawful or illegal? Okay, well, how about this? For the laser and the keratome up extra costs, lawful or illegal? Illegal, right? So cataract surgery, no matter how they do it, by laser or whatever, is a covered surgery. They can't pretend to you that you have to pay to get some kind of technique for laser surgery. All cataract surgery is covered. It's a medically needed surgery, no matter by what method they do the cataract surgery. Everyone got that? So what's the test? Not how they do the surgery, but whether or not the surgery is medically needed. Cataract surgery is a medically needed surgery. It's covered. Okay. I don't think they can charge a COVID-19 charge for $10. I think that is also a scam. And then to tell him that he had to pay $50 for eye drops, not allowed. We actually phoned OHIP about this because this is so common. And because the eye drops are needed for the surgery, they are a covered service. They can't charge you for it. And then any checkups, follow-up checkups, they can't charge you for those, right? A physician consult is covered. That's what we won when we created public medical insurance. Okay, I'm going to give you another example. And this one I think is the last one. Sorry, let's just see. Oh, second last, sorry. This patient was charged $580 per eye for his cataract surgery, $350 per eye for special measurement tests, and $141 for eye drops. He's 71 years old and he's now working in his retirement because he wasn't able to afford the surgery. Legal, not legal. Totally not allowed. Cannot do it, right? Okay. Moving on. So, I mean, if they tell you that the special measurement tests are optional and don't kind of try and persuade you that they're fantastically better than OHIP and that OHIP is inadequate, you can opt to pay for them, but they can't require it. Okay, and this is the last one. So this patient had to pay out of pocket for laser cataract surgery on both eyes. The surgeon informed her that if she was to go through the public system, she would face a long wait time of possibly over 2 years. Sorry, this patient was also told that the laser eye surgery was only performed at the private clinic, not the public hospital. Lawful or illegal? Lawful or illegal? Illegal. Cannot do it. And at that point, I would just want to stop my share because I want to show you something. This thing about the wait times is just a complete scam. And I mean, it is true that there are wait times for things. There's no question. But the public has been inured, gotten used to this idea that there will be wait times. So people will believe wait times that are ridiculously long, even though they're not true. So I want to just show you where you can check. Okay. So I'm going to share my screen and I'm just going to go to a Google search. Okay. Can you see that okay?
Yeah,
Yeah.
we can see the Google search.
Okay, great. So I'm just typing in Ontario wait times. That's all you have to type in. And what will come up is the wait times website for Ontario. Shulin still doing okay? Okay. So I'm going to click on that. And you'll see that I'm now in the Ontario wait times website. Okay. And so you can go to this website and you can see websites for surgery, for diagnostic imaging like CTs or MRIs, and for emergency departments. So I'm going to go to surgery. I'm going to check cataract surgery. It's the most common private clinic. Okay. And so let's say I want to see, I should be able to type in it. Where do I go? See wait times for surgeries and procedures. Wait, sorry, let me make sure I'm doing the right thing. Okay. So I'm going to click on surgical wait times. So I'm just following the website. Okay. Everyone see what I'm doing? Clicking for surgical wait times. I'm clicking for an adult. And I'm going to choose a location. Okay. So I'm going to choose Oshawa. Okay. And then it's asking me what surgery I want to search for. So let's say cataract. And I'm just going to say cataract. Okay. So let's see the results. Okay, so it gives you 2 wait times. The time from the referral to a specialist, and then the time from the time that the specialist says you need a surgery to the actual surgery. So from the referral to the specialist, this is for September of this year. Gives you the provincial average. So patients are triaged based on need, right? There's no one dies if they don't get cataract surgery. So there's no priority 1 patients. Priority 2 patients have cataracts that are like seriously ready to have their surgery. So they should get them the fastest, 30 days. Priority 3, their cataracts can wait longer. They're not quite ready, can be 90 days. Priority 4, their cataracts aren't really ready for surgery yet, can be up to 182 days. Okay. So you can see there's different wait times based on your priority. And the overall wait time for Ontario is 51 days for the most urgent patients. And that means that like 90% of patients are seen within 51 days. The less urgent patients, 107 days. So what's that? Just over 3 months. And the least urgent are seen within 99 days. So again, just over 3 months, right? In Oshawa, they didn't have any priority 2 patients. So priority 3 patients are seen within 52 days. So a month and a half. Priority 4 patients within 58 days. So about 2 months. So not 2 years. I mean, people are routinely going to private clinics and being told that the wait lists are 2 years. That is not the case, not in most parts of Ontario. And you can look around also and see, if you are willing to go somewhere else to get the procedure faster, you can look around and say to your doctor or your optometrist, in the case of cataract surgeries, well, I'm willing to go to Oshawa and I see the wait time is only, whatever, 40 days or what have you, right? Okay, so I'm just gonna turn it now over to the students to do their presentation just for a few minutes, and then I'm gonna open it up for questions and answers. Okay, so I hope that was helpful for everyone. And where are you? Yanina and Yeji? I'm so excited. This is their first time doing this, by the way. There you are. Okay.
Okay, awesome. So Elena, she has a video, so I'm pretty sure she's gonna share it when she's ready on the screen. And as I've mentioned before, me and Vijay are nursing students, and we have a video prepared for you guys, like a small introduction, what is Medicare, and some stories on what Medicare is. And then after that, we're gonna go quickly over some historical facts together. So, thank you.
Okay, I'll just play the video now. I'll just play a couple seconds. Let me know if it's okay.
So have you ever wondered why in Canada you don't have to pay out of pocket when you visit your family doctor or go to the hospital for medically necessary services? Let's talk about it. This is public Medicare. Public Medicare is Canada's public healthcare system. With it, medically necessary hospital and physician services are fully covered, so there's no bills to pay, no invoices, just present your health card and you're ready to go. And before public Medicare, Canadians had no choice but to forget medical treatments due to the very high costs, leading to the unnecessary suffering and even death. And this book, it's called Life Before Medicare by Helen Hanley. It tells a story of a young woman with cancer who refused pain medication because it would bankrupt her family. And for 2 months, she had her husband lock her in her home while he left for work, so no one could enter and hear her screaming in pain. She did not want to bankrupt her family as she was dying, and this story reflects many Canadians what they have experienced before Medicare. And if you look at the difference today, healthcare costs are nearly doubled per person in the US. And more than 26 million Americans didn't have healthcare insurance in 2023, and millions delayed their treatment because they simply couldn't afford it. But here in Canada, things are very different. Thanks to our Medicare system, healthcare based on needs, not your bank account balance. So no one is buried under medical bills, drowning in debt, or driven to bankruptcy. And Canada takes pride in a system where your health isn't a financial burden and is accessible to all. So now that I have explained what Medicare is, let's dive into the history of public Medicare.
All right, then I'm gonna share my screen. Oh, can you guys see it well?
Yes.
Okay. So first off, the first public hospital insurance plan in Canada was introduced by the Saskatchewan government led by Tommy Douglas in 1947. And then in 1957, the federal government passed a law to start sharing half the cost of principal and territorial hospital insurance plan with the provinces and territories. So Ontario created a hospital insurance plan 2 years later in 1959, and all the provinces and territories had done the same by 1961. Also in 1961, Saskatchewan expanded their Medicare program to be a public medical insurance plan, meaning that it covered not only hospital services, but physician services provided outside of hospital too, like in doctor's office. And 90% of Saskatchewan's doctor went on strike for 3 weeks because they wanted control over how much they billed patients. So the government held strong and brought in public Medicare, but with an amendment allowing doctors to opt out of Medicare and extra bills, which is charging patient extra user fees on top of public Medicare. In 1964, the Diefenbaker government's Royal Commission on Health Services called for national public Medicare. So 2 years later, in 1966, the federal government passed a law to start covering half the cost for physician services provided outside of hospitals as well. By 1972, each province and territory had created public medical insurance plans that cover hospital services and physician services provided outside of hospitals. Then, in response to doctors' extra billing patients, the Canada Health Act was passed in 1984, establishing fundamental principles for the healthcare system and banning extra billings and user fees. Also I'll scroll down. And in 1995, Paul Martin brought in the most regressive federal budget in our history. The Canada and Social Transfer combined federal funding transfers to the provinces for health, post-secondary education, and social services into one block fund, and then they cut federal health transfers by 40%. These cuts, combined with provinces responding with their own funding cuts, led to expansion of private clinics. And Yanina gonna continue explaining.
So I'm going to continue explaining from the 2002 Romanov report. So basically, Ontario 2004 commitment to the Future of Medicare Act to enforce the Canada Health Act, banning extra billing, user fees, and restricting access to insured services with penalties for violation. And the 2006 Harper government slowed progress, cutting back on healthcare involvement and scaling down the Canada's health transfer by limiting 6% escalator, reducing federal health funding by $36 billion over a decade. And then in 2016 to 2017, the current government, what we all know, Trudeau government, only minimally modified Harper's huge cuts. The provinces rejected their funding proposal, so the Trudeau government left the negotiating table with all provinces and instead went province by province, pushing through 10-year bilateral deals. And it means different deals between the federal government and each province to pressure the provinces and territories into adopting the proposal. And we also have a national dental care insurance plan, which was passed in 2022. However, the federal government contracted with private insurance corporation Sun Life to administer the plan. And lastly, we also have a Pharma Care Act that was passed in 2024 to create a national pharmaceutical insurance plan, starting with the coverage for contraceptives and diabetes medications. However, like Alberta and Quebec are already planning to get out of a plan. So access to pharmaceuticals will vary across the country compared to different provinces. So this was our presentation on the
Yeah.
history of Medicare.
And I hope this helped and clear to understand too.
Thank you very much, Gigi and Yanina. Yay! Congratulations. Good job. Okay, so with that, let's open it up for questions and comments. Now, Alana is watching the Facebook. You'll let us know if there are questions or comments from people there. And Genevieve is watching the chat, and she'll let us know. And Ye-Chen, you'll let us know if there are questions in Mandarin or Chinese in the chat. So Ye-Chen? Oh, you're on mute. Sorry, my dear.
Yes. So I have gotten 3 questions for the Mandarin chat. So the very first one is, does OHIP cover HPV screening for women who over 45 years old?
HPV screening. So they're asking like that would be a pap smear, no?
So should they pay by themselves or the OHIP covers?
No, OHIP would cover HPV screening or should cover HPV screening. I don't know what they mean by HPV screening. Like if it's a regular normal type of screening, yes, it would be covered. If there's something medically unnecessary about the screening, like I'm not sure if they're asking because there's some kind of screening that may not be medically necessary.
The question
That's
was
why they're
not
asking.
that specifically, just asking the HPV checking or screening like that. Yeah.
Right, so that would be considered medically necessary and it would be covered normally. Yeah.
Mhm. Okay, so the second question is to request a test report from a laboratory. The person got required to register as a member and asked to pay $11 membership fee per year. Is this legal?
No. They cannot charge you a membership fee in order to get lab tests in Ontario. Lab tests are medically necessary diagnostic tests and they are covered. As long as they're medically necessary lab tests, if you know what I'm saying. Yeah, so like in some cases, vitamin D tests may not be covered. But I mean, regardless, a lab can't require you to pay a membership fee in order to access a medically necessary service. So no one actually can require you to pay a membership fee in order to access a medically necessary service. That includes a private clinic, it includes a lab, etc.
Okay. And the last question I got it, the same person asked a family member went to the eye check for the eye infection and was asked to pay $140 for an eye exam before he could have his eyes checked. Is this charge legal?
Was it in a, okay, so optometrists can charge fees. So I mean, it depends. If they went to a doctor, no. But optometrists can charge fees.
Yeah, I think it should be a private eye checking.
Yeah, and sometimes people don't know if they're like an optometrist who might refer you on to an ophthalmologist who is the specialist, like who does the cataract surgery or does complex eye issues, is not the same as an optometrist. And sometimes people don't know who they're going to see, you know what I mean? But anyway, your family doctor cannot charge you. No, like a doctor can't charge you for checking out an eye for an eye infection.
Okay, thank you. That's all the Chinese questions I got so far.
Okay, thank you. Okay, Genevieve.
So in the Zoom chat, we've got a number of questions. The first one is, if you are faced with charges, how do you challenge them? Do you bring in a copy of the law, or how do you push back against the charges they're trying to make you pay?
Yeah, so you're gonna need proof of payment, which should be doable either because you'll have paid with a credit card or a bank card or something like that, and you'll have a record in your bank statement, even if you don't have necessarily a receipt or something. So you're gonna need to be able to prove that you actually paid. And then you can make a formal complaint. Now, the issue that we've come across is that the private clinics lie. I mean, so for example, they'll tell a patient that they have to pay for cataract surgery, but when the patient gets the actual receipt, it'll say that they've paid for something medically unnecessary. You know what I mean? Like the woman with the MRI, and on the bill, they said it was the contrast. So you got to check your bill. And if they did that, you need to tell OHIP that they did that. And what we've had to do, so for example, one private clinic in London, they did that to one of our local health coalition members, to his wife. And so he's working with us and has now found a bunch of patients that went to that private clinic, and they did the same thing to all of them, which is going to strengthen our case with when we go to the ministry and make the complaint about that clinic, right? So I'm going to share my screen for 1 minute. This is also will be on our website tomorrow under the slide for this presentation. We'll have the presentation up and all of the information, but this is the toll-free number and the email. And I'll put it in the chat. Okay, I'll just copy it and paste it into the chat as well for you. And it'll be on our website, okay? So I'm giving you a minute to write it down. People I see are writing it down. So it's 1-888 662 6613. And the email is protectpublichealthcare, all one word, @ontario.ca. Okay, and I'm just going to paste it into the chat right now. But I wanted to ask you this. We're putting together a formal complaint to the provincial government and the federal government, and we want to demand patients' money back. So under the Commitment to the Future of Medicare Act in Ontario, if a patient has been illegally charged for a service, they have to pay the patient back. So that's what we want to do, but we'd like to do it in a way that gets the most attention possible. Like, we needs to be on the TV news, and everybody needs to know that this is the case. And so if this has happened to you and you want to make a complaint, will you do it through us? Will you work with us? Because we have 50 patients right now and we're trying to get more. We're going to do this in January. People can keep it private. We don't need to use your name necessarily, but if you're willing to speak publicly, we will be holding press conferences as well all across Ontario, and we want to make a big issue about this. And it's Alana who is collecting the patient stories and working with patients to pull together the documentation and so on needed. So Alana, can you put your email in the chat? Or just the whatever email, info@ontariohc.ca. And just let us know, okay? And maybe Sally can you put the regular email in the chat too? And just let us know. And leave us your phone number so we can talk to you about the details. So you'll need the details, you'll need proof of payment, and you can go and make a complaint, and they're supposed to pay you back. But as I say, if they have lied about what they charged you for or something, then we have a bit more, we have to put a little bit more effort in to find other patients from the same clinic. And once you have 3 or 4 or more people saying the same thing, I mean, they have to pay attention to that. Do you have any more, Genevieve?
Yes. Another question is, what is the definition of medically necessary?
So there's no formal definition in the act, in the Canada Health Act, and it would be very problematic if there was, because obviously that would change over time and so on. So it's a bit circular, like in Ontario, you can't charge for an OHIP covered service. So that's kind of how it's defined. And the thing is that they have sort of an expert panel or expert panels to determine what is and isn't medically necessary. So because all kinds of biotechnology and, various companies would like their things to be listed under OHIP because they can make a lot of money, there has to be some measure. And the measure is whether they show efficacy. So like if you do that eye measurement test, does it show better outcomes than if you don't do that eye measurement test, for example, right? And so if it doesn't show efficacy, that is, there's no added benefit for doing that different type of test, then it is not covered. That's how they do it, and it's done by clinicians, like expert doctors, and based on the evidence. So that's how we do it in Ontario.
There is another question, or a few questions related to doctors' offices charging for what they are calling administrative fees, and similarly being charged an annual fee so that the doctor will renew your prescriptions with the pharmacy.
Yeah. So these are block fees. They're what are called block fees. So they are allowed to charge you for medically unnecessary stuff. If you go in person, they can't charge you for a prescription. If they do it by phone, they can charge you, which is stupid. I know, like it's dumb, but that is the way it is. And I guess that happened, I think, in the 1990s when they started allowing, I think it was the Harris government. But anyway, if it's like a sick note for work, they can charge you for that. It's not medically necessary. If it's like a camp physical for a kid or something like that, they can charge you for it. It's not medically necessary. So what some doctors' offices are doing is charging a block fee for that type of paperwork. And it's an annual fee. We have always opposed this because people believe that if they don't pay it, they won't get as good care, or that others will get faster appointments and things. That's one problem. That's not allowed. You can't sell faster access, no matter what. But people worry about that and feel coerced into paying it. And the other thing is, if you don't use it, say they charge you a block fee of $200, and it's supposed to cover all of those medically unnecessary add-ons over a year. But if you don't use it, they have to return to you the difference. Right? Say you only have one $10 phone-in prescription. Well, the other $190, they can't just pocket that. But no one gives it back. So, I mean, we don't like it, but they're allowed to do that. Okay, any other questions, Genevieve? Maybe I'll just get all the remaining ones from the chat that are sort of major questions, and then I'll just open it up here for maybe 10 minutes, and then we'll wrap up for the night, if that's good. Like I'll deal with all the remaining questions at once.
There's one more question. How are ambulance fees covered?
Oh, yeah. So you can be charged for an ambulance. And they changed, oh boy, I have to look up the details on this. They changed it so that people who are ordering medically unnecessary ambulances would be charged a higher rate. I think they've left that in place. But you can be charged for an ambulance if it's medically necessary. It's transportation. It's not covered. I'm sorry. It's terrible. It doesn't make any sense, but that's the case. Now, I was the executive director of the Epilepsy Association and from 1995 to 2000. And our patients had would have seizures and then they'd be unconscious and someone else would call an ambulance and they'd go to hospital and they would end up being billed for the ambulance. So we would challenge that, and always that ambulance fee would be forgiven. And if people can't afford to pay, they can do the same. But I mean, that's sort of, people don't know that, and it's kind of a hard thing to do. But yeah, but they can charge you for an ambulance. It doesn't make any sense, eh? Like it should be covered. Okay, so, and I saw Jules made a note that in the north, the wait times for, cataract surgery were way, 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 way longer. And I take the correction, you know, that's fair to put that correction there because obviously in Thunder Bay, they are. I really meant like and I should have specified, thank you, Jules, for the correction, but in the south, you know, where we're hearing from people, it's like London and Guelph and Brampton, where people are being told 3 years, 2 years, whatever waits for cataract surgery. Or you can go to my private clinic and pay, you know, $1,000 and, you know, essentially jump the queue. Well, that's illegal. You can't legally, and they can't accept payment for that legally. And the wait lists are not 2, 3, 5 years. They're not even 1 year. But you know, Jules, good point. They are long up and not, and for some procedures, the wait lists are long. Like, don't get me wrong. I'm not saying that things are all roses out there. They're not at all. But this thing about private cataract surgery clinics lying to patients is very common. Okay, so any other questions? So if you have a question, do you want to just use the raise hand function? If you can move your cursor down in the bottom, across the bottom of your screen, usually there's a toolbar and it says react with a little heart. Or maybe sometimes it'll be like a little face with a plus sign, smiling face with a plus sign. And if you click on that, you can raise your hand. So if anyone has a question or comment, you can raise your hand. Okay, go ahead, Barbara. You can unmute.
I think, it's more of a comment. As a child, I appreciated what the young ladies, to me, I'm 65, so almost 66, their presentation. And I grew up, and with the extra billing, my family always ended up at the emergency. And because the doctor my mother had at the time in the 60s, this is as it was just getting started, okay, charged extra billing. So being a very poor from a very seriously dysfunctional family on my father's side, we had to go to the emergency all the time. And that was the only way we could get OHIP coverage. And I'm finding that it's starting to seep back in, because back in 1995, I worked for doctors for 10 years until my health got bad. And my boss even said, Barbara, it's already here. Privatization's already here. And so that's when the block fees were started, was 90, 95, 98, around there.
That's
and
right.
The first cuts that happened were Mike Harris government in 1986. So my question, I put it on the board as part of chat, but my question is, does anybody know what's going to happen to the new civic campus at the Ottawa General Hospital in Canada's capital? Because they're designing it as a private room only. The whole facility is going to be top notch, and it's private room only. And that's what they did to the old Royal Ottawa Psychiatric Hospital. And you can't get a doctor in there if your life depended on it. You're told to go out in the community. Well, the community for psychiatric is 2 years. And it's really scary. It's really, really scary because they've downloaded the emergency. They downloaded the emergency department onto regular emergencies departments. And you should hear I'm in for heart problems, and you should hear the nasty comments staff make about psychiatric patients coming back and back. Well, they're
Okay.
trying to look for a lifeline, and they wonder why a lot of them end up on the streets.
Okay.
My biggest concern is it going to actually does he have enough power to board to push this privatization through?
Okay. So I'm watching Shulan, who's trying to keep up.
Oh, I'm
It's
sorry.
probably easier for her if we sort of try and keep the question kind of simple. Sorry, Barbara, but
I'm
it's
sorry,
okay.
yeah.
That was a big, complex question.
It was. I'm sorry.
No, please don't apologize. It's an important one. Okay, so just one thing for the students, Yeji and Yanina, part of their fact sheet and briefing note and video had a story from Life Before Medicare. Do you guys want to just share that quickly? You can just tell it. You don't need to screen share or anything. Yeji or Yanina?
The students did have to leave
Oh,
a
they're
while.
gone. Okay.
Yeah.
Okay, so there, in the book Life Before Medicare, which was published by the Ontario
You know all about that.
Senior Citizens Association, yeah, they a society of OSSO. What's it called now? Ontario Society
OSSCO.
OSSCO.
Mhm.
Ontario Society of Senior Citizens of Ontario, something like that. There was a story of a woman who lived, I think she was in Saskatchewan, and it was a farming family, and she was dying of cancer, and she didn't want to bankrupt her family, and so she asked her husband to lock her in the house so people wouldn't hear her screams of pain, and she wouldn't bankrupt her family. And that was what life was like before public Medicare. And so thank you for raising that. And the students included some of those stories in
Yeah.
their briefing note. On the Ottawa Civic Hospital, so there's two things, and I don't have time to get into it tonight, but they are building the new facility as a P3, public-private partnership, as they call it, like they did the Royal Ottawa Hospital,
Mhm.
which is a far more expensive model. It uses private for-profit finance. It's much, much more expensive than if we just borrowed, if the government borrowed publicly and built the hospital. And it results in less money available for doctors and nurses and health professionals and care. So that point is well taken. The private rooms, as in, is there one patient in a room or two patients or four, et cetera? That's the new design that they're using for hospitals to reduce infectious disease. And the Sioux Area Hospital was built that way. And so, as I said, you cannot be charged for a private room if that's the only kind of room there is in a hospital, right? So say I go to the Sioux Area Hospital, and there only are private rooms, I'm not going to be charged a private room rate for that room, right? So that's now I don't know exactly if they're private rooms, if they have more luxurious private rooms that they charge more for or whatever. I haven't actually looked at that, but anyway, that's the deal. So you can't be charged for a private room if that's the only kind of room that's available. Okay? Okay, so that answers some of, not all of what you're saying, but some I hope. Okay, I'm gonna take Rose Marie. I don't know whether it's Rosemary or Rosemarie and Adrian, and then back to Genevieve, and then I'll answer them all together if that's okay, and we'll wrap up for the night. Go ahead.
Yes, it's Rosemary.
Sorry, Rosemary.
No worries, no worries. Listening to all this information tonight, for myself, I'm amazed at how much I don't know about what is covered by OHIP and what is not. And it's kind of an uneasy feeling to think that with lack of information, that you can be lured into things that and pay for them that you don't really need to. I'm wondering if there's any kind of a resource available, either online or some kind of hard copy that you can get a hold of that lists the things that OHIP does cover.
Yeah, I mean, there's like there's the schedule of benefits, which is massive and has everything. But we will have on our website that slideshow. And
Okay,
then the fact sheet for, like, as I say, in Ontario, it's where the private clinics exist, where most of the illegal user fees or unlawful user fees and the manipulation of patients is happening. And in Ontario right now, mostly that's cataract surgeries. That's where we have private clinics. At the moment, we don't have private hip and knee surgery clinics or the like. And,
Mhm.
that's why this matters so much. That's why we're fighting so hard to keep them out and to roll this back. So this is gonna matter leading into the next provincial election, which is gonna be likely in the spring. So we have to make this a big issue. But on the website, we'll have the slideshow and the fact sheet about cataract surgery with the details of what is and isn't covered. And I think that should help a lot with most of the things. Thanks, Rosemary. Yeah, I'm glad we're doing this because I feel like it helps. But you're going to need to look at the written resources because it gets confusing until you're used to thinking about it. Generally speaking, if it's medically necessary, it's covered. That's okay. Thanks you. Okay, Adrian and then Genevieve, and then I have Shulin 3, public 3.
Historic. I just want to comment on the fact of the paramedics. A lot of people don't realize that the paramedics are not funded by OHIP or the government. They are funded by their municipalities. And the biggest thing happens is the only payment that they get for the trips is what they bill you. Now, under the law with the paramedics that they implemented is the fact that even though they may be utilizing the ambulances or whatever, and they don't pay them, if you call an ambulance again, they can never refuse you. They have to pick you up no matter what. So the thing happens because a lot of the bills for the ambulance services are not paid. And so the paramedics go without. And I have a lot of people who work as paramedics, and I know exactly what they go through. And that's the reason why our ambulance services are dwindling. And they cannot get people hired to do it. Their shortage in paramedics is unfathomable, especially up here in the north where I live. And they have difficulty even getting equipment and stuff in because the bills are not being paid.
Okay, thanks, Adrian. I'll come back to that too with a little bit more, Genevieve.
I have two questions from the chat. One was, is it legal for a physician to charge to give Botox injections for migraines? So it's not cosmetic, it's migraines. And the second question is, or comment was, someone was charged for an ambulance after being in a car accident, and is that legal?
Okay, thank you. Okay, and I'm gonna take the last one, Shulen 3, public 3.
Oh, hi. Thank you to let me talk. I just put on the chat already because I was hit by the car a few months ago. And then I get the invoice and I have to pay for the ambulance. Is it okay? Is it illegal or legal? I pay already, but I'm confused, right? At that time, I'm unconscious. Somebody saw me, I was hit. I come in 3 days at the hospital.
I'm just checking. I think ambulance fee rates.
They sent me the invoice. I'm shocked, right? I pay it right away.
Do you know how much it was?
I can't remember. I'm coma.
Okay.
Whenever I
It's
woke up,
saying
and
right
then the
now.
ER doctor told me, do you know where you are? Do you know
Sorry.
your name?
Who? What?
The doctor, ER doctor.
Okay,
Because
sorry.
at that time I'm unconscious. I'm in coma. And then somebody saw it and then called the 911, something like that.
Okay, yeah. So as I say, like when we had patients who were unconscious and didn't need an ambulance, like they had a seizure, they normally had seizures, that's what happened to them. And they didn't need an ambulance, they didn't need to go to hospital, but someone else called an ambulance on them, we would make that argument and we would get the fee dropped. In your case, one, you've already paid, and two, you needed to go to hospital, it sounds like. So yeah, they are allowed to charge. And someone put in the chat, it was $45. I checked and it is, the copay is $45. Now, there was something,
Yeah, I think it's 45, something like
yeah,
that.
so they're allowed
Yeah.
to pay. Thank you. And I'm gonna come back to those two other questions. Carrie, I'm gonna give you the last word and then I'm gonna wrap up.
Yeah, excuse me, I receive Botox for migraines, and as is the case, I believe, with other injections for certain vaccines, there is an injection fee, not for the visit. I pay $200.
Yeah, so
Yeah.
if you're out, like if you're not in hospital, you're in your doctor's office, so you're not a hospital patient, medications are not covered, right? Unless you're a senior and you're on like the Ontario Drug Benefits Plan and it's covered there or what have you, in which, in which case that's a different ballgame. But if it's not, if you're paying for the Botox, probably not the injection per se, that's probably what's happening and they're allowed to do it. I haven't looked up that particular thing and I can double check that, but I'm pretty sure. And if there's anything like that, like a kind of detailed thing, you can always call OHIP and ask them. Call the OHIP info line. So when we wanted to know, are they allowed to charge patients for the eye drops in the cataract surgery clinics? We phoned the OHIP info line. We just looked it up online and phoned, and we asked them, and they told us. I mean, that's their job, right? So you can check those things too if you think that there's something and you want to know whether or not they're allowed to cover it or charge for it. Okay. So then just back to the other two questions. Sorry. Oh, sorry. I think we answered them all. So ambulances and Botox. So I'm gonna go back. Actually, I'm not gonna go back to the slideshow. I just want to end with this. That patient story from the man who was 71 years old, who went in for cataract surgery, had this whole array of charges that ended up being almost $1,000, wasn't it, Alana? Like it was a lot of money for a pensioner to be paying for medically needed service. When we won over, it took really 100 years to build public Medicare in this country. We won hospital insurance, then we won medical insurance. Every time they've tried to bring in extra user fees, we've won national legislation and provincial legislation to protect patients. And under the Ford government, I have to say, in Ontario, we have never seen user fees like this. It's like the wheels have come off public Medicare. They're charging fees all over the place. And the more they get away with it, the more they're charging people fees. And it is the undoing of public Medicare in this country. And it doesn't help the health system. Not one penny of that is going into improving health services. It's literally going into the pockets of the highest charging doctors. Ophthalmologists are millionaires. They're billing public Medicare for $1 million plus, and they're charging pensioners, people who are elderly, who are on fixed incomes on top. It's greed. That's all it is. And we just can't let it happen. So I'm really grateful you're here for the information, but please be here for the fight too. I mean, we're giving this information, but we shouldn't have to, because if we didn't have all these private clinics, we wouldn't have all these user fees. It just wasn't the case before, and we need to roll it back again. So thank you all very, very much for being here. And anything you can do, if there are patients who are being charged, if we can publicize, if anyone is willing to speak publicly, if you can help us with our formal complaint and our reports and our press conferences in the winter time, that would be very, very helpful because we can make this a key issue leading into the provincial election next spring and really try and push this back and win commitments from the other political parties, from all of the political parties to stop this. You know, this is my life's work now. I didn't realize it was going to be, but it is, to protect and improve public Medicare for everyone in Canada. And I'm just going to end with this. Sorry, Shulin is sharing a QR code for the WeChat for the Chinese community. So that's what's on the screen. But when we unscreen share that, so I'll let you just snap that if you want it. And then we'll stop the screen share for 1 minute and I'll just close with one very quick thing. So do you have that QR code if you need it? Okay. I just want to see your faces for the very end here, but I don't know if they're going to pull that down.
Yeah. So please just give me 1 second. Let me
Thanks,
translate to
Yujin.
everyone, please.
Oh, go ahead.
好，大家现在看一下屏幕上面呢，是我们这个安省公共医疗政策的 WeChat 群组，就是咱们的微信群组啊。那大家扫一下，拿出你的手机或者是 iPad，扫一下咱们的这个QR code 啊，这个二维码就可以加入到我们的群组当中啊。这个没有关系，咱们各大其他的群当中也会发布类似的这个二维码。如果大家现在不方便来扫呢，这个之后我们也会有一些这个在其他群里面也会发。但是大家现在这个时机不错，那大家抓紧时间扫一下。
Thank you, Yujin.
You're welcome. So
Okay.
please just give them about 30 seconds or so.
Okay.
Let them please let them scan.
Scan that QR code. It's very cute with the two little chats in the middle. Okay. Okay. So people should have it. Okay, thank you very much. And so I just want to say this, you know, it's the reason why I think this matters so much is that public Medicare is the biggest social transfer in the country. It's the biggest transfer of income. You know, we're taxed based on our income, and the highest income earners, the wealthiest, pay the most. The middle income pay what they can, the lowest income, the least or not at all. And all that money is pooled in free services like education, like healthcare, and parks and recreation, and our roads and transit systems and so on, you know, the infrastructure of our communities. And these things improve our standard of living. They give us the potential to live to our human potential. They create equality of opportunity. They're critically important in our society. And you know, if you imagine what life would be like without public Medicare in this country, how much poorer the poor would be, how much richer the rich would be. It's already far more extreme than it was in any of your lifetimes. You know, it's just greed and it causes enormous suffering. And so if I can say anything, you know, it's critically important. This is the largest creator of equality in the country. Of income equality in the country. And without it, I don't think we would recognize our society. So please, if you care about this fight, please do help. And we've got a few months to make this a key issue in the Ontario election, and we really are at risk of losing it. So thanks so much for spending the time with us tonight. Good night, everybody. Thank you.